Good evening, everybody. I am Dr. Rishikesh Behre, Medical Director and Senior Consultant Psychiatrist at Manoshanti, Pune. And I have with me Dr. Shalaka Chaturika, who is a Consultant Psychiatrist also at Manoshanti, Pune, and Dr. Naren Rao, who is also Medical Director at Manoshanti. We welcome you all to our online live webinar today on the occasion of World No Tobacco Day. So the World No Tobacco Day is celebrated on 31st of May, and it is primarily to raise awareness about smoking cessation. As you all know, that almost 20 to 30% of India's population is addicted to tobacco in some form or the other. It could be smokeless tobacco like chewing tobacco, or in the form of smoking cigarettes or BDs. And the health risks that are associated with smoking are very high, and its adverse effects range from a multitude of cancers to risk of stroke and heart attacks, and is a direct cause of death in a large number of cases. So on this occasion, Manoshanti is conducting this webinar to raise awareness about what are the ways in which people can take attempts and steps to quit smoking, and also to raise awareness about the scientific methods of smoking cessation. So we come across a lot of literature in social media and in popular media about different ways of quitting smoking. However, a lot of times the proper scientific method is not followed, because of which success rates, people do not get success in smoking. Even in our regular practice, many times when we suggest about smoking cessation to people, people tell us that, oh no, I have already tried gums, it doesn't work, etc. But there is a scientific method to how an approach to smoking cessation has to be followed. And that is our aim today, to spread awareness regarding this. So I would first invite Dr. Shalaka to give us an introduction and overview about the principles of smoking cessation, and how and why somebody gets addicted to nicotine. Over to you, Dr. Shalaka.
Thank you, sir.
Yeah, Shalaka, are you able to share your screen? Yeah.
Hello.
Yeah, you're audible. You can go ahead.
Yes, okay. So good afternoon, everyone, and a very warm welcome to all of you to today's webinar. I want to thank everyone who's taken the time to attend the webinar and see the video, and I'm confident that this will prove beneficial for all of you. My name is Dr. Shalaka Chaturikar, and I am a consultant psychiatrist at Manoshanti, Pune. As Dr. Berry rightly said, that on the occasion of World No Tobacco Day, which was on 31st of May, we here at Manoshanti have come up with this initiative to spread awareness as well as to help those who wish to quit smoking. So we'll be talking about what that initiative is and how do we plan to go about it in a minute. But right now, I'll be taking about 10 to 15 minutes of your time and talk about addiction and its scientific aspects. So before every movie, we see elaborate advertisements saying that smoking is injurious to health. Public places are adorned with posters and signboards prohibiting smoking. Cigarette packets themselves have gory images of cancer printed on them. Then why is it that people find it difficult to stop smoking? So let's understand the biological basis of tobacco addiction a bit better today. Let's start with some basic trivia about tobacco itself. So tobacco is one of the most widely abused substances worldwide. Few of the causes can be its easy availability, its cheap cost, and the influence of social media, where the use of tobacco is glorified. Smoking, tobacco use is one of the leading causes of preventable disease and death worldwide. In India, about 30% of our population consumes tobacco in some or the other way, and up to 10% of deaths each year are accountable for by tobacco use. This is why we need to specifically keep our focus on quitting tobacco. Now, why is tobacco harmful? So, we all know the various health concerns caused by tobacco, like cancer, bronchitis, asthma, heart problems, stroke, diabetes, skin and bone cancers, infertility, as well as a lot of mental health conditions such as anxiety, depression, psychosis, eating disorders. But what exactly are the contents in tobacco which result in all of this? So you have nicotine, which narrows the blood vessels, reduces the amount of blood flow and oxygen that reaches your organs and causes organ damage. Then there is tar, which is a greasy black substance which coats your airways and lungs, makes it difficult to breathe, and causes a variety of lung disorders. Carbon monoxide and ammonia are toxic chemicals which cause irritation, inflammation, and organ damage, as well as many dangerous cancer causing chemicals which are known to cause mouth cancer, lung cancer, stomach cancer, and so on. Now, what exactly is addiction? Saying that someone is addicted is used fast and loose in our society. But what do we as clinicians mean when we speak about addiction? So, addiction is a chronic neuropsychiatric condition characterized by craving, loss of control, as in you start with a cigarette or two and then it goes on to 5, 10, and you can't control that. Tolerance, withdrawal, salience, as in keeping smoking or prioritizing smoking ahead of the other tasks in your life, and loss of risk insight. That despite knowing the various health damages that it can cause, one continues to smoke. Now, let's talk about some of these key terminologies that we know. Intoxication. Intoxication is a sense of high. When there is an acute increase in intense drug use, there is an altered physical as well as mental condition. So, when there's increased use of tobacco or increased smoking, a person may feel lightheaded, dizzy, very happy, stress free, lightweight. But remember that this is only a temporary condition when the drug levels in your body are very high. After that comes the withdrawal phase, which is also called as detoxing. So there are physical and mental symptoms that occur due to sudden reduction or stopping the use of that particular drug. So when it comes to tobacco, when you suddenly stop or suddenly reduce the amount of smoking, there can be irritability, restlessness, difficulty concentrating, sleep problems, anxiety. Then there is tolerance, where there is increased dose or frequency of the drug required to get the same benefit or effect as earlier with lesser dose. So, for example, if initially someone used to smoke, let's say 1 or 2 cigarettes per day, to get the same high, the same happiness, the same stress freeness, now they use up to 10, 20, 30 or so cigarettes per day. So this increase in cigarettes from 1 or 2 a day to 10, 20 a day is called as tolerance. Then there is craving, which is a strong, urgent need or desire to use that substance, either to experience the benefits or to avoid the negative symptoms or the withdrawal because of absence of the drug. It's also called an urge where you need to smoke a cigarette. You can't do without smoking a cigarette. So this can be either cue based or mood based. So, cue based can be when you go out with your friends, certain environmental factors, seeing the shop from where you buy tobacco, with alcohol, or with a specific meal in a day. So, that environmental factors are cue based. Or then there is mood based. So, if you feel low, if you feel anxious, that's when your body craves a cigarette. So, prolonged chronic use of any substance causes certain chemical and structural changes in the brain, which makes a person repeatedly engage in the use of that substance. Like I said, it can be to continue experiencing the highs of the substance or to avoid experiencing the lows. Now, whatever the reason may be, there is a cycle which keeps on going. There are three distinct stages in this addiction cycle. And see if you've ever experienced this or felt like you're stuck in this loop. So there is stage one, which is the binging or the intoxication, where there's increased acute use of the drug and you feel the high. Then there is stage two, when there is sudden reduction of the drug levels in your body. You have certain withdrawal symptoms like tremors, restlessness, feeling irritable, feeling anxious. And then there is preoccupation or anticipation of the next time that you will be using the drug. So when is the next time that I'll get a cigarette? When is the next time when I'll get a break? I can go out, smoke, or use tobacco. So this cycle of binging, then having the withdrawal effects, then preoccupation with the next use is the addiction cycle, which a lot of people find themselves getting stuck in and unable to get out of. Smoking is one of the most difficult addictions to do away with. Now, why is that so? What makes it so addictive? There's a chemical aspect to it as well as a behavioral aspect to it. So, first, talking about the chemical aspect, whenever someone smokes a cigarette or uses tobacco, there is a dopamine peak. So, dopamine is a happiness hormone. It stimulates the pleasure and reward centers in the brain. There is a peak or a sudden increase in dopamine which happens, and then it dulls down after 2 to 3 hours. So, when there is this dopamine peak, there is reduction in stress and anxiety levels, mood improves, and there is enhanced motivation to do work. And the need or seeking this kind of peak is what reinforces the behavior of smoking. So, to break the addiction cycle, it is necessary to break this chemical cycle. And we will see how this is done shortly. The second aspect of it, or the behavioral aspect of it, is what we call as conditioned behavior. So, there is association of smoking with certain actions or activities in the day. There is a desire to continue smoking, and that is maintained by these certain behaviors. For example, with your morning coffee, before using the toilet, while using alcohol, with friends at your regular meet and greet spot, passing by the usual shop where you buy the cigarettes from. So, all of this reinforces smoking behaviors. And to break the addiction cycle, we need to break this behavioral cycle as well. Finally, a lot of people face blame and stigma regarding their cigarette use, saying that it was their choice, that it's their fault. Whereas there are certain factors which literature speaks about, which contributes to taking up a substance use as well as it becoming an addiction. So, what are these factors which predispose a person or which show a vulnerability to addiction? So, there's difficult childhood circumstances, peer influence, strict parenting, poor academic performance, certain stressful life events, which is just difficult to cope with. This is more common in men, more difficult to quit in women once started. Certain genetic predisposition, if there's a family history of using substances, pre existing mental health condition, and certain personality factors like high impulsivity, which can predispose a person to develop addiction. So, all of these biological and behavioral factors play a role in developing an addiction as well as developing a plan towards de addiction. And we will see how all of this features into that. So, in conclusion, I would like to say that addiction is not your fault. We saw a very complex neurological and neurobiological basis to it. But getting away from addiction, stepping towards a healthy lifestyle, that is your choice. It may seem challenging, but I assure you, it is rewarding. Be determined, take the first step, and we are here to help and guide you through this journey. So today, join us and commit to quit. Thank you.
Yeah, thank you, Dr. Shalaka, for that nice introduction about smoking and also what the addiction cycle is and what is the brain chemistry behind how addiction is caused. Now I'll continue from where Shalaka has left off, and let us see how the concepts that Shalaka has mentioned, that it refers specifically to smoking, and how we can use these concepts to embark on a program of quitting smoking. Yeah. So specifically, when we talk about addiction to smoking, what we are actually talking about is an addiction to this chemical called as nicotine. So nicotine is the active ingredient in tobacco, which causes the addiction. When nicotine enters into your brain through the blood, it causes a short-term increase in attention, memory in the short term, and that is why a lot of people who smoke, they report that they feel good when they consume the tobacco. It may be in the form of chewing tobacco or in the form of smoking. Also, nicotine releases chemicals called as adrenaline and dopamine, which gives that perceived high that people experience. So the function of adrenaline generally is to increase your heart rate, increase more pumping of blood into your organs and into your legs. So because of that, in general, there's a sense of increased rush and energy levels. And when we smoke tobacco, the nicotine reaches into our brain within 7 seconds, and that is a very quick and a fast effect. So if you look at this graph, which plots against time the level of nicotine in your blood. So if you see this spike here with cigarettes, so as soon as you smoke, so within 7 minutes, the nicotine peaks in your blood and causes that rush. And that is why also nicotine is one of the most addictive substances that we know. And the reason for that is that in a very short span of time, the nicotine can enter into your brain and produce its positive effects. So why should one quit nicotine? Right. So as we all know, and we have multiple times, this has been reiterated and is available in the public domain that uh, so tobacco contains more than 50 known carcinogens. It is associated with more than 16 types of cancer. It is associated with an increased risk for stroke and heart attacks. So if you look at this graph, you can see that over the age of 50, continued smoking beyond the age of 50 is associated with an increased risk for death, which ranges from more for 10 to 15 times higher chance of death above the age of 50 in smokers. So it has been established beyond doubt that smoking is a risk factor for death and mortality. So some of the reasons, despite having this knowledge, why people continue to smoke. So they are addicted to the nicotine. Okay. So even if they want to quit, the brain has adapted to that nicotine in a way that it cannot function without the nicotine, and that so there's a strong addiction to the nicotine. Second, there could be social reasons and peer pressure. To fit into a group, people take up smoking, and smoking becomes a form of being in a group. You take a break, you go to have a tea, you share a cigarette, that becomes a form of bonding. So that social reason becomes one of the maintaining factors for the addiction. Because the property of the nicotine to release dopamine and adrenaline, which are associated with the feel-good factor, people use it for stress relief. People who smoke generally have some weight loss, so some people see that as a positive benefit. Some people who have mental health issues also have comorbid addiction to smoking, and that makes them continue to smoke for a long period of time. However, what can be some of the additional reasons why which can make somebody quit? Encouragement from family and friends. Okay. Obviously, your friends and family are concerned about your health. They are concerned about the harmful effects of smoking and would be constantly encouraging you to give up the habit. The health improvements that you can see with cessation of smoking in terms of your increase in your lung capacity, your ability to do more physical work, the benefits that you will see on conditions like diabetes and hypertension and your heart health. Another important reason could be that obviously you're going to save a large amount of money. The amount of money with every passing budget, you can see that the government only goes on increasing the prices and taxes of on nicotine. So the amount of saving that goes into somebody, if somebody is smoking 20 cigarettes a day and is deciding to quit, the savings can be huge. In women who smoke, pregnancy is a big motivating factor for quitting smoking, because it is established beyond doubt that smoking during pregnancy is harmful to the growth of the child. And people who have developed medical problems, if you have hypertension, you have had a heart disease, or you have diabetes, or you have developed lung problems, that should be a big motivating factor to quit. So what to expect while quitting? So people do experience nicotine cravings, some withdrawal symptoms, as Dr. Shalaka mentioned, like some jitteriness, restlessness, some impact on sleep, some irritability. Uh, Weight gain can be something that people can experience. So it has been seen that around 3 to 4 kgs of weight gain over a year can happen in people when they are quitting. But there are ways in which all these things can be managed, and that should not deter anybody from attempting to quit smoking. So next, coming to the most important point, that how to quit. So what is the step one? The step one always is that making that decision that I want to quit. I want to quit, and I am willing to do what it takes to quit. So this decision making is usually seen as a cycle, which we call as a motivation cycle. It starts with, I don't want to quit, then translates into a realization that maybe I will quit. I want to quit, but it's too difficult to quit. I will quit tomorrow. So continuing to postpone, and tomorrow never comes. So the first step is always to take that step into deciding for yourself, deciding what are the pros and cons of smoking, how smoking is going to benefit me over the long term, and how it is going to have a positive impact on my life, and deciding that I'm willing to do what it takes to quit. So that is a very good starting point, and that is very important. Step two comes that once you have decided to quit, okay, so you have to overcome two challenges, which is one is of a physiological addiction, that is the brain becoming addicted to the effects of nicotine, and second is what we call as a behavioral addiction. So you all know of the famous Pavlov's experiment, where the dog, which is conditioned to a particular stimulus. So whenever the bell is rang and the food is presented, the dog gets conditioned to it. So similarly, smoking also is sometimes like a conditioned reflex, that our brain starts associating smoking with different activities that we do in our daily life. So from the moment you wake up, you go to the washroom, you have a cup of tea, you drink a newspaper, I get out of the house, I sit to work, I take a break in between work. So each of these activities, your mind starts associating with the act of smoking. So because of this, what happens is that even if there is no real craving, even if there is no real withdrawal, your mind starts wanting or starts driving somebody to go pick up a cigarette and start smoking, because it just becomes like a learned behavior. So if you, from the graph that I've shown you previously, if you see, usually an effect of one cigarette lasts for around a couple of hours. That is the duration for which the nicotine remains in your blood. So even if you calculate your waking hours, so let's say you're awake for 10 to 12 hours in a day, so if you calculate, you really don't need more than say 5 to 6 smokes in a day, even if you are addicted to the nicotine. But we see that it's very common for people to smoke more than 10, 20, two packs per day. So most of those smokes is beyond a physiological addiction. It is a behavioral addiction. And that is the part of the smoking that which should be reduced first. And by making some behavioral changes, it is possible to reverse that. Right. So as I said, that breaking the behavioral chain, that is very important. So we start associating every smoke with every activity that we do in our life. So breaking that chain between us, that association between that activity and the need for a smoke. Okay. So mixing up your routine, changing your routine, not doing the same things at the same time helps your brain to break that chain and associate that a particular activity with a particular action. The second thing is we are talking about dopamine, how nicotine causes a dopamine release. And so in a sense, your brain over a period of time gets hooked to that dopamine, right? So this dopamine release also happens what we also call as a cheap dopamine, that it can happen when you are uh, addicted to gaming. It can happen when you're addicted to alcohol, junk food, gambling, social media, any other drugs, smoking. Okay, so all these are like a cheat sheet for your brain to get dopamine. But however, real dopamine comes from physical activity, exercise, good sleep, rest, working on your goals, outdoor activities, giving yourself new experiences, right? So in a way, you need to, when you bring about your behavioral changes, you need to change the source of the dopamines from these behavioral addictions to positive addictions, which can uh, give you that dopamine in a safe manner. So these are some behavioral changes that we need to bring about. Step 3 is to set a quit date. So once you have decided that I'm going to quit and I'm going to do all it takes to quit, we have to decide on a quit date, which is usually recommended to be around 10 to 2 weeks, 10 to 15 days after you start making these behavioral changes. So set a target for yourself that this is a date on which I am going to stop smoking completely. Set reminders. Remind yourself by putting up, it could be on your laptop screen, you could put up that date. You could put sticky notes around you. Importantly, inform your significant others, people around you with whom you spend maximum time, that I have decided to quit smoking on this particular date. So that will act as a social mechanism for you. So you know that I have informed this to people around me, so they will keep a check or a watch on me, or they will help me or remind me that I have taken this decision and will help and support me. So that is very important. Step 4 is that when you start getting off the smoking, there will be some craving in the initial phases. So here are some behavioral strategies by which you can handle craving. We call these as the 5 Ds. So first and foremost is delay. So delay that immediate temptation to go and pick up that smoke because you're having that craving. Just remind yourself that let me just wait for 5 minutes and I will then think about it at a later point of time. That delay helps a lot in just overcoming that immediate urge. Okay. So in those 5 minutes, when you delay the smoking, you need to distract yourself. This distraction can be by going away from that situation, just going for a walk, just picking up the phone, making a call to your a friend or somebody whom you identify, to whom you can reach out if when you're having this craving. Just drinking a glass of water or a fruit juice helps to just soothe the irritability and the jitteriness. Deep breathing and relaxing your nerves plays a very important role. And always reach out and discuss with somebody whom you can identify that, whenever I have craving, I'm going to reach out to you, I'm going to talk to you and share how I'm feeling. And so talking to this person will help you to calm down your nerves and act as a distraction. So these are some behavioral methods. But it's also important because, as we have always been saying, that this is a physiological addiction. Your brain is addicted to this chemical. So you also need to break the chemical cycle. So there are medications that can help you to reduce the craving, and they have been found to be quite effective. So we principally use two types of medication. One is called as a medicine called as bupropion, and second is a medicine called as varenicline. Varenicline commonly available as Champix, and many of you may have heard. The way the medication helps is that it stops the nicotine from attaching to the nicotine receptors in your brain. So even if you're smoking, it does not give you the same high It will reduce the craving. It will ease the symptoms of withdrawal, and it will not give you that boost that you get when you are smoking. So parallelly starting these medication along with the behavioral mechanisms are play a very important role in helping somebody to quit smoking. Another important way of handling craving is what we call as nicotine replacement therapy. So I bring you back to that graph that we saw, that whenever you smoke a cigarette, there is a sudden release of nicotine within 7 minutes. It reaches your brain, and that is what gives you the high. Okay, so what a nicotine replacement does is that in a safe manner, it replaces nicotine in your blood. So this can be done either by nicotine gums. They come in 2 milligrams and 4 milligrams. Usually, if somebody is using less than 20 cigarettes a day, we use 2 milligrams, and somebody using more than 20 cigarettes a day, we use 4 milligrams. And you can somebody can use even up to 12 or even more gums per day, depending on the craving and depending on the need. And a regime is then advised by the doctor, and it is gradually tapered over a period of time. Another way of nicotine replacement is by patches. So these are once a day application patches, which slowly releases nicotine in your system. And they come as varies from 7 to 21 milligrams, depending on how much somebody is smoking. So the advantage of these nicotine replacement is that it doesn't allow a sudden peak of nicotine in your blood. So because of which you don't get that sudden high. At the same time, you don't get the sudden drop in the nicotine. Hence, and it prevents the craving and the withdrawal. So there is a sustained or a mid level of nicotine which is constantly maintained in your bloodstream. So it takes care of a large amount of the craving and the withdrawal that somebody can get when they are stopping smoking. The last step is relapse prevention. So over a period of time, when using medication plus the behavioral strategies plus the nicotine replacement, so this process can take anywhere between 6 to 12 weeks. And with this, once somebody has quit the smoking, we have to safeguard against relapses. So we need to identify what are the cues and triggers because of which an individual is smoking. These cues and triggers could be just day-to-day routine. It could be stress at work. It could be somebody having relationship problems. It could be just peer pressure. So we need to identify these cues and triggers and have strategies how we are going to deal with this. So a psychologist in the counseling process will equip a person to come up with strategies to prevent these relapses in the future. Stress management is going to be a very important part because more often than not, stress is a factor that makes people uh, go to smoking as a immediate stress relief mechanism, and also developing alternate coping mechanisms, avoiding cheap dopamine and bringing in activities in your routine which give you true dopamine. All these go a long way in relapse prevention. Some common misconceptions that people have when they approach smoking cessation is that I can quit by myself. A lot of people say I don't need any help. I can once I decide that I have to quit, I can quit it at any point of time. So all I need is just willpower. Yes, willpower is needed. It's an important component, but as we said, that smoking is not only behavioral addiction; it is also physiological addiction. So you also need to understand the brain physiology and how smoking is causing an addiction, and use that in a scientific method to quit the smoking, which only a professional and expert can guide you. Second common misconception is that I can reduce and stop. I will just reduce one cigarette every day and try, and so I'll bring it down to zero. That unfortunately does not really work always. And the reason for that again is that because of the chemical addiction that the nicotine has caused in the brain, the brain has got accustomed to a certain level of nicotine, and unless it is that is handled by way of medication plus the nicotine replacement therapy, it becomes very difficult to just reduce by and taper down a regimen of smoking. And lastly, a lot of people say that they use vaping and e-cigarettes, and they say that that is safe. And by switching to that, so I have stepped down from smoking to e-cigarettes or vaping, and hence I will be able to reduce alcohol. We get that a lot in our clinic when people telling us that. The problem with that is that even though it may be vaping and e-cigarette, it still has nicotine in it. So you're still getting that quick fix of nicotine. So it is not I mean, it is you're just replacing smoking with something else, and that is not going to help. Uh, Plus, there is something called as a cue-induced craving. That is the very act of holding something that looks like a cigarette, the very act of the smoke, the very act of putting something in your mouth, that constantly keeps reinforcing the brain, it just leads to an endless cycle of craving. So which is not cut off by using vaping and e-cigarettes. And also e-cigarettes and vaping have a lot of aerosols in them, which are also equally carcinogenic as much as a smoking cigarette. So vaping and e-cigarettes is not an answer to smoking cessation. So these are some of the points that we wanted to cover to raise awareness about how to approach scientifically smoking cessation. And finally, we would also like to introduce our 4-week curated program for quitting smoking that we are implementing at Manoshanti. So this is brought about by under expert guidance, a scientific method to quitting smoking, wherein we take an individual through a 4-week program, which includes a group therapy, individual consultations, yoga therapy with a combination of medications. So we start with week 1, wherein work on the motivation of the individual who wants to quit. Week 2 involves behavioral strategies and taking the first steps. Then we help the individual to set a quit date. And week 3, handle craving. And week 4, equip the individual to have the strategies towards relapse prevention. So if you know anyone in your circles who is struggling with smoking and would benefit with smoking, so do refer them to our program, and wherein we can help them in a scientific manner to quit smoking. And remember that quitting smoking saves lives. So do help your near and dear ones. Thank you. Thank you so much for your patient listening. If anybody has any questions, they are free to ask us. You can either put them in the chat box or you can unmute and ask a question. We're happy to take them.
So, Mr. Bere, this is Priya here, and
Yeah, hi Priya.
we really like the way the presentation was made, and it really connects to us because, like my husband, he is smoking, so we got to know this seminar and we joined today, and he is actively interested to do this.
Sure.
Yeah, it's been actually. Hi, my name is Umang,
Hi,
and
Umang.
my age is 43 now, and it's been more than 25 to 30 years now since I'm smoking now. So it has become very difficult for me again and again. I've been trying to, quit. Then again and again, it's like it's coming again and again. So there are so much of issues. Like every time I struggle to leave the cigarettes, but it's every time it's like I end up taking again and again. So I've been to a psychologist before also. So they also suggested me with Bupron and Champix. That also I tried for some time, but again I left the tablets again. Then again I started smoking. So the cycle, as whatever I've seen here in the presentation today, like many things I could relate to myself. So
Right.
I would definitely like to, connect with you guys and quit it.
Sure. Yeah. I mean, so what's important is not to give up the attempts, because
Right.
right, because a number of times you try once, you try a second, a second time, maybe first time you did not succeed, but the second time would be better than the first, the third time would be even better.
Right.
Right. And so that the fact that you're attending this webinar and indicates that you're really motivated to quit, and once you're motivated, it's half the job done, and the
Right.
other half is following a scientific method to and following the process. So we can definitely help you with that. Maybe you could connect with us after the seminar, and we will definitely help you out.
So how to join this program? Like, is it a online or is it a offline? How is this?
So where are you based?
We are based in Pune.
You're based in Pune. Yeah. So this program would be best done offline, and we are offering this in Pune at our center in Baner.
Okay.
In Baner.
And
Okay,
what about
great.
online? Do we have online also here?
Yeah. So I mean, it is a once, like it's like a once a week kind of a program. So it would be best
Okay.
done offline.
Okay.
Right. So we can have an initial online chat and understand the issues, and we can guide you. But and if you can just then come in and meet us once in person, that would be great.
Sure.
Definitely, definitely. When can we come in, sir, to meet you?
Yeah. So we are open Monday to Saturday. So maybe we can after the seminar we can just connect and schedule up a time.
Definitely, sir.
Sure.
Definitely. Sure, sir.
Yeah. All right.
Yeah.
Yeah.
Thank you. Thank
Thank
you so much,
you.
sir.
Thank
Thank you.
you.
Okay. Yeah. Great speaking to you. Yeah.
Yeah.
Sure. Are there any other questions or any other doubts that people have? All right. So if there are no other questions, so thank you all for taking the time and attending today's webinar. We hope that you got some useful information and that the information would help people listening to this webinar and other. We will make this recording available for later viewing as well. So so even if those who are not present today in the webinar can you can refer them to our YouTube link to watch this. Shalaka, you have any last comments?
Nothing more to add, sir. I'm just I'm glad and I'm hopeful that people will reach out to us. It's a good, nice initiative that uh, Manoshanti has started. And yeah, the first step to quit, I guess, is being aware of the problems and being determined to quit. So that was a lovely. Um, Thank you for sharing your experience with us, Mr. Umang. And we're hoping that more people are become aware of this program. And if you know people, you can share this with them as well. Yeah, that's about it, sir, I think.
Yeah. Okay. So thank you all. And so we'll end the webinar here. But we end with a note with the understanding that this is just the beginning. Thank you all.
Thank you, sir. Thank you so much.
Thank you.